welcome to the program Healthy Living on Trust Television. I am Aisha Salihu. Now, the month of September wouldn't be complete without us raising awareness about the dreaded sickle cell disease and sickle cell anemia, as the month is regarded as the National Sickle Cell Awareness Month.
Sickle cell disease is a group of disorders that cause red blood cells to become misshapen and break down. The cells die early, leaving a shortage of healthy red blood cells and can block blood flow, causing pain, known as sickle cell crisis. Al-Musanna Ibrahim is a 27-year-old patient of sickle cell disease and organizing secretary, Gombe State Sickle Cell Association. He said life has been very difficult, surviving with sickle cell disorder.
Living with sickle cell anemia is very difficult because we are facing many challenges. I remember that time when I was at home by 3 o'clock having crisis or a lot of pain, and I take my old drugs. It didn't work for the pain, and if we go to the hospital, they will assist me with fluid and blood transfusion. You know,
medical experts say the burden of sickle cell can be reduced if couples know their genotype before engaging in a marital relationship.
The sickle cell state, if one is avoiding a spouse or a couple with whom he has chances of giving birth to a sickle cell anemic baby, that could reduce the burden of the sickle cell anemia, because the carrier state usually don't present with any clinical features of anemia or any clinical features of complication.
Due to the high cost of managing sickle cell disease, the Gombe State Sickle Cell Association is advocating for the provision of free medical services to sickle cell survivors to ease their sufferings.
Our condition is very difficult. We need a good proper care, as I said. We just need free drugs, and if possible, to approve our healthcare free. In case of crisis, if you go hospital, you get blood and your medicine.
The government should have a way of enrolling them in a form of a health insurance scheme that will cover them. Or if that is difficult, government should have a kind of means by which this sickle cell patient could get registered and get most of their drugs, and when they have complications, most of the surgical or otherwise interventions they need, government should look at making it free for them.
At least 100,000 babies die from sickle cell disorder in Nigeria every year, according to 2014 statistics by the World Health Organization (WHO), making it the #1 sickle cell endemic country in Africa.
Nigeria alone accounts for 66% of the cases of babies born annually with sickle cell disorders in sub-Saharan Africa, according to data from the Federal Ministry of Health. The World Health Organization says over 300,000 babies globally are born annually with sickle cell disorders, with over 75% cases in sub-Saharan Africa. To mitigate the trend, experts say couples and parents need to take genotype testing, newborn screening for expectant mothers seriously.
Out of that 300,000, more than 150,000 of those sickle cell disease babies are born in Nigeria. In their antenatal clinics, you know, the mothers, expectant mothers, usually are educated and they are encouraged to do their genotype testing. Then when they come for immunization, we also talk to them, counsel them, and then screen the newborn babies.
But if it is SS, that is sickle cell, we'll have to talk to you personally, call you, counsel again, in order to prepare for the management. We bring them to the pediatric unit. Here we have a special center there for sickle cell. So the enrollment should be within these 3 months of age. So once they are enrolled, and folic acid penicillin is being started immediately.
Children born with the disease are prone to early death if they are not followed up with appropriate care.
And then we train the lab persons. So if the lab persons are 3, 2, depending interns, we train all of them to be able to take these samples. They will go also to train the midwives or the ladies, the nurses that are in charge of the immunization units. Will take the samples through a dry blood spot test. So this test is dried in the lab and then shipped to the center.
We already have multi-level standard of care guidelines for the management of sickle cell disease, which we will use in training those healthcare workers in the primary healthcare centers to provide health maintenance, for our babies.
Sickle cell disease makes up a large percentage of childhood under 5 mortality. Experts say the disease will negatively impact on the attainment of health-related sustainable development goals for high-burden countries if efforts at control are not instituted or expanded. Being one of the most common inherited blood disorders, it is a time to recognize the perseverance of patients living with sickle cell disease and sickle cell anemia, to recommit ourselves to improving the quality of life and health outcomes for all individuals living with the condition. Now let's go on the streets of Abuja to hear the perception of people about this disease.
It's quite unfortunate that it's been around for quite a long time, and we seem not to have a lot of research in that area here in Africa and in Nigeria, where it's prevalent. And just like other health institutions in Nigeria, we need a lot of investment and proper research to help better the lives of those who are suffering from those kind of diseases. Sickle cell in particular is something that, when it starts for those who are affected, it's really, I've seen 1 or 2 people in crisis. It's not something that you wish for anyone. And we really hope that as with the economic situation, that those who are going through those challenges now, the families, because it takes a lot of their income. In fact, I know families that have been impoverished and families have fallen apart because of this challenge of sickle cell anemia.
In area of sickle cell disease, I experienced that is from blood. When I was in secondary school, I have a schoolmate that has sickle cell, and my teacher taught her that most times sickle cell is blood. When the partner want to marry each other, they have to go to blood test to know whether their blood will balance so that they can be able to marry themselves. But if the blood did not balance, I think they can born somebody that will have sickle cell. I don't think sickle cell is not an infection. So for me, I can associate with anybody that has sickle cell. Since is blood, even if I eat with a person, it cannot affect me. So people differentiating themselves and they're running away from those that have sickle cell, I don't think it does not make any sense.
Yeah, sometimes sicklers, some of them, when they give birth to them, they come with the sickness. And based on what they told us when we were a little child, they said sicklers, after 20 or 21 years, they will die. Or anyone that lives above 21 will not die again. So I don't know the truth about that, but that is what they used to tell us those days. But I, as a person, sincerely, I don't think I can marry a sickler, unless I don't know. But if I know, I don't think I will, I don't think I will do that. But it's not I'm discriminating among the seculars, but that is just my own perspective about that.
I heard some people saying that sickle is inherited. So when you marry a sickle woman, maybe you can born also a sickle child. That's why I can't.
Yes, I can marry a sickler, and if I love her, I can marry her and also help her in taking medications and help her to manage it.
And now, actually, there are technologies, there are inventions, there are things we know now better, how to prevent it, how to take care of, how to manage it. So I believe, yes, you can marry. I think there are options now out for people that are marrying sickle cell. So it's something that you can still manage. You can still, there are innovations in the hospitals and health is out there.
Well, I think to be fair to I think the health system, I don't think you get much because they are more aware. So if you talk about discrimination, I think maybe it's for those that are not really aware that you find that stigma and discrimination. And then maybe like in schools, I know in secondary school then, or when you hear people teasing those that are sicklers, you're not going to live long, or you're sickly, you can't play sports or other things. But they could actually live a normal life if they are well managed. Just that you have to be wary of certain things that maybe like cold, they are more susceptible to cold, they react more. Just like anybody who is immune is weak, definitely has to be a bit more careful.
Now, if you have sickle cell disease, you may need one or more blood transfusions, healthy blood from a donor put into your body during your lifetime. For further elaborations and to share more perspectives, I have joining me virtually Dr. Garba Umar Kangiwa, who is a consultant hematologist and blood transfusion specialist at the Federal Medical Center, Birnin Kebbi. Thank you so much for joining us. Now, I'd like to start us off with the current burden of sickle cell disease in Nigeria. And what would you say are the biggest challenges to managing the sickle cell disease in the country at the moment?
Currently, Nigeria is the capital city for sickle cell disease in the whole world. We have the highest burden of sickle cell disease in the whole world. Every 4 Nigerian that you see, one is a carrier of sickle cell gene in Nigeria. That gives us a 25% of carriers in Nigeria for sickle cell disease. And we have about 1 to 2% of the total population of Nigerians as patients with sickle cell disease, as homozygous sickle cell disease. So Nigeria is a capital city for sickle cell disease in the whole world. We have the highest burden of sickle cell. Now, one of the major challenges of sickle cell disease is that it's an inherited disorder which are transmitted by the 2 parents. So when an individual contributes an abnormal gene to the offsprings from each of the parents, now the 2 abnormal genes coming together now form what we call sickle cell disease. Disease can be either a homozygous SS or it can be a compound heterozygous sickle cell disease as a disease. So being an inherited disorder is one of the major challenges of this disease that is transmitted by majority of people that are not even aware of their genotype before the marriage. These are some of the major issues. So people go into the marriage before actually without knowing their genotype, so as to be careful of who should be their partner. If somebody is carrying an abnormal gene, as somebody that is carrying an abnormal gene, an AS, or any of the abnormal genes, so to say, marry somebody with another abnormal gene, they stand the possibility of having an offspring which actually becomes a sickle cell patient. So these are some of the issues that are the challenges that are actually contributing to the widespread of this disease in this country.
Thank you so much for narrating, giving us about, talking about the challenges of the disease in the country at the moment. Now, I'd like to know, what would you say are the latest advances in sickle cell disease treatment and research, and how can we also improve access to affordable and quality sickle cell disease care in Nigeria?
There are a lot of researches ongoing, and some of them concluded about sickle cell disease, the treatment care, first of all, the early detection, of sickle cell disease. A lot of improvement has been ongoing. We have so many diagnostic facilities available in the country now. In Nigeria, we have them like high performance liquid chromatography, ZPLC, that is available in most of the strategic places in Nigeria. They are available in all the 6 sickle cell centers in the country, each center in one of the geopolitical zones in the country. That's one. Just secondly, the other diagnostic tools that are very common are also available in most of the facilities that actually that are affordable to majority of the citizens that can afford the test before marriage for people to know their genotypes. Then thirdly, you have what we call point of care testing, which will be validated here in the country. About significant number of centers participated in the validation exercise in the West African countries. In Nigeria, I think we have about 21 centers that participated in validation of these point of care testing screening technology, which we call sickle scan, or we call it hemotype SC. So that technology is very simple, just like pregnancy test, like any other screening exercise that is so simple and rapid time. So in less than 10 minutes, you will see the results. So that again is available. So that in the diagnostic approach, a lot of researches has been done, and so much advances has been done in the sickle cell.
Okay.
So it's left for people to actually assess some of these diagnostic tools available in order to know the genotype of their genotype and even their children's genotype.
Okay.
And again, another diagnostic tool is in vitro diagnostic technology, where you assess the DNA of the fetus in vitro inside the womb of his or her mother. At that moment, one should be able to, but it's a higher tech technology that are actually not accessible, that is not accessible by many, but is accessible by the few that want to access it. So it's available. If you want to know actually the genotype of your baby in utero, you'll be able to know that. That's number one. The diagnostic technology, a lot of advances has been achieved in sickle cell disease. Then in the management aspect of sickle cell disease previously has been a disease where hardly you see a patient with sickle cell disease actually survive up to 20 or 30 years. But today we have people that are up to 60 years or even 70 years with sickle cell disease because of the advances in the management aspect of patients with sickle cell disease. So once they are detected early and then enrolled in the treatment, such individuals or patients or clients are actually well taken care of, and their quality of life actually improves.
Okay, doctor, let me cut you short just a little bit. Now, earlier you'd recall I talked about the role of blood transfusion for sickle cell disease. Now, I'd like for you to just very briefly tell us about the indications for blood transfusion in sickle cell disease, and are there like different types of blood transfusions that are used to treat sickle cell disease? I just want to know the disparity.
Yes, one of the advances in the management of patients with sickle cell disease is in the area of blood transfusion. Actually, the blood transfusion now can act as a standalone therapy in patients with sickle cell disease in so many conditions. For example, patient with stroke in sickle cell patient, one of the complications of sickle cell disease is actually stroke, where an individual will develop a stroke. It used to be stroke being developed by patient with hypertension. But patients with sickle cell disease, a lot of them actually develop stroke. So one of the management strategies of patients with sickle cell disease is actually use of blood transfusion. So you can use external blood transfusion where you totally remove and exchange blood of the patient with sickle cell disease with hemoglobin A blood, and that will actually resolve within 72 hours for most over on over 98% of cases, it will resolve the stroke when detected early. So that's number one. Number two, majority of patients with sickle cell disease, actually, they have recurrent anemia. From the name is sickle cell anemia. So it's a recurrent anemia, and individuals tend to come with on and off anemias because their hemoglobin, the half-life of their red blood cells is reduced from the normal half-life of 120 days to about 18 to 20 days, or to 25 days, or below 30 days. So you can now see that the red blood cells of patients with sickle cell disease do not live longer enough to carry out its function. Therefore, most of the patients with sickle cell disease actually present with anemia. So anemia can be treated with blood transfusion, either as a top-up blood transfusion, where an individual will be coming from time to time and be receiving blood to treat anemia, or as a chronic blood transfusion regimen, where we place a patient on particular transfusion, on particular transfusion from time to time. Every 3 months, patient will just come and receive blood transfusion with hemoglobin A blood. So these are some of the types of blood and some of the indications of blood transfusion in patients with sickle cell disease. There are other indications for blood transfusion, like patients with intractable bone pain, where you need to do an extra blood transfusion for them. An individual with priapism also that is not responding to the conventional treatment, you can actually do an extra blood transfusion for them. You have individual with multi-systemic organ manifestation of sickle cell disease, so that individual again can also benefit from blood transfusion. So what blood transfusion does is actually reduce the viscosity of blood and increase oxygen delivery to various tissues and organs in the human body. So through that, blood transfusion has now become a stand-alone therapy in the management of most of the complications of patients with sickle cell disease.
Now, I'd like to know, what would you say, what are the challenges towards providing safe and effective blood transfusion in Nigeria?
One of the major challenges in providing safe blood transfusion in Nigeria is actually lack of adequate awareness to the people to donate blood voluntarily. Safe blood is supposed to be donated by a voluntary blood donor. A voluntary donor is an individual, whether a male or female, who volunteer on his own without any entitlement or anything actually that will be a compensation to the blood he is going to give. He will voluntarily donate blood in order to save life. That kind of blood is what we call voluntary blood donation. So there is paucity of knowledge about voluntary blood donation in Nigeria. There is a lack of general sensitization of people to actually venture into voluntary blood donation in Nigeria. That's number one major problem. Lack of awareness and then sensitization to the people about voluntary blood donation in Nigeria. Number two, we need to have a system in place which actually move from place to place, from schools to different places for gatherings, institutions, in the market, in any form of gathering of people where the outside blood donor drive will now go and seek for people to donate blood. NYNC people and other people should be mobilized. Women should be encouraged to donate blood, and the other people with rare blood groups should also be encouraged to donate blood. People should be encouraged to become regular blood donors so that their names, they should be fully registered in their centers all across the country, in their centers, so that they will be able to donate blood. There is a lot of benefit of donating blood. A lot of people are not aware of some of these benefits. Look at this way. When you donate blood, number one, you have the happiness of saving your brother's life.
I'll have to cut you short right there so that I can take my very last question just before we go. Just very quickly, what would you say are the latest advances in blood transfusion technology and research that could benefit people living with the sickle cell disease?
Presence of apheresis machine is one of the recent advances in blood transfusion system. Apheresis machine is they are devices or equipment that can be used actually to do an external blood transfusion simply. Before we rely on using manual XM blood transfusion, now we have machines and other devices that we can use to actually exchange their blood quickly, to remove their own and then replace their own with normal blood. Then secondly, single donor blood donation system. If you want to donate only red blood cells, you can go and donate only red blood cells, and then every other component, the white cell, the platelet, and plasma will be returned to you as a donor. So as a donor, you have a choice of what you can donate to a patient, to anybody you want to donate. So these are some of the recent advances that have been achieved in blood transfusion system worldwide.
All right. Thank you so much, Dr. Garba Umar Kangiwa, who is a consultant hematologist and blood transfusion specialist at the Federal Medical Center, Birnin Kebbi. Thank you so much for your time.
Thank you very much. I sincerely appreciate it.
With that, we've come to the end of the program Healthy Living on Trust Television. And do not forget that for comments, contributions, and suggestions on the program, do well to follow, subscribe, and like all of our social media platforms. Join us again on another episode of the program Healthy Living on Trust Television. I'm Aisha Salihu. Thanks for your time.